Hey Freedom Lovers, this is Dr. Peterson Pierre with America's Frontline Doctors, bringing you today's Daily Dose. In a recent interview with Tucker Carlson, HHS Secretary Robert F. Kennedy Jr. revealed that the CDC conducted an internal study in 1999 on a possible link between the Hep B shot and autism. The researchers, led by Thomas Versraten, were quote-unquote shocked by the findings. Quote, they looked at children who had received the hepatitis vaccine within the first 30 days of life and compared those children to children who had received the vaccine later or not at all. And they found a 1,135% elevated risk of autism among the vaccinated children. And it shocked them, end quote. That's a pretty high number. Hepatitis B is a disease primarily transmitted through sexual contact or drug use. Nevertheless, the CDC recommends the Hep B vaccine for newborn babies. The reason this is unknown to the public is that the CDC buried the data. Quote, they kept the study secret, no surprise, and then they manipulated it through 5 different iterations to try to bury the link. And we know how they did it. They got rid of all the older children, essentially, and just had younger children who were too young to be diagnosed, end quote. The health secretary said that the CDC, quote, did a lot of other tricks, end quote, as well to hide the data. Kennedy has previously maintained that the CDC's recommendation of Hep B vaccines for infants came as a favor to Big Pharma. That's pretty obvious. Babies don't do drugs or have sex. The federal government had asked pharmaceutical companies in the 1970s to develop a vaccine for the gay community, where drug use and unsafe sex had become rampant. But once the vaccine was developed, there was low uptake among homosexuals. After the drug companies complained about the lost revenue, here comes the CDC to the rescue. They agreed to add the vaccine to the childhood immunization schedule. The study on the Hep B shot was not the only evidence of autism in vaccines that was discarded. The DTaP vaccine was also linked to autism based on data from the CDC's VAERS, which the agency uses to monitor vaccine safety. But when VAERS showed a link to autism, the medical community dismissed the data by claiming VAERS was unreliable. Quote, what they were saying, the Institute of Medicine, now the National Academy of Medicine, which is part of the National Academy of Sciences, was that the only system CDC has to study vaccine injury is so bad that any study done on it were not going to count, end quote. Do you see the conflict of interest? Can somebody just make that make sense? Ladies and gentlemen, only the truth will set you free. Stay tuned for the next Daily Dose.